Good morning, everyone. Today, welcome to Autism Mama Bear Talk. Today, we have a very special guest, the man, the myth, the legend, the one and only Dr. Daniel Nuzum. Welcome, Doc, and thank you for being here. I invited you to my show because of your history, because of your personal story, and because of what you do. So very briefly, you have been rewarded the license of natural medicine at the age of 20. Is that right?
Correct. I
The
was the youngest.
youngest, the youngest naturopath in the U.S. history at that
Yes.
time. Wow. Also, you were raised in the huge family. Although you are the only biological son of your parents, who are also doctors of natural medicine,
Yes.
correct me if I'm wrong,
Yes.
but
Correct.
also they were adopting children with all kinds of disabilities uh, until 32 beautiful children found a loving home.
Yes. Correct.
Saints.
I have 23 adopted brothers, 9 adopted sisters.
Wow. Amazing. That's a blessing. So could you please tell me your story and
Well, sure.
how it all
Sure.
started and how you got involved into the natural medicine and you know
Great. Well, I like we said, my parents they're naturopathic physicians, and so I grew up with natural medicine. It was just
Mhm.
what we had. I tell everyone I was 8 years old when I found out people got shots. I was very perplexed. I couldn't believe people got shots. I thought that was for cats and dogs.
Yeah.
But what happened is my buddies, my friends in the neighborhood, all came home in one afternoon, and they were all sick,
Hmm.
and they were very sick, and none of them could come out and play. And finally, one told me that they had got their shots that day, and I went home crying. I got home. My mom thought, she said, "Well, did you get in a fight or what happened?" And I was, no. So what's the matter with these people? And
Right.
she's like, "What's wrong?" I said, "Why are they taking their kids to the vet?" I,
Yep, I can see how. Yeah.
so I thought they were taking their kids to the veterinarian and
Wow.
giving them shots. I was like, "Oh, no wonder they're all sick." It was
Right. Yes.
And so I had a really different upbringing. My upbringing wasn't conventional.
Hmm.
Um, we're very spiritual Christian family,
Yes.
um, and so as I grew up, um, I learned more and more about medical practices. But most of what I learned through doing a lot of the physical therapy and the care for my disabled brothers and sisters that my parents had adopted.
Hmm.
And so, you know, changing diapers, doing physical therapy, feeding children, handling a lot of what would have been in-house nurse care, that kind of thing. I did that growing up. It was just what I did.
How old were you
Um,
then?
that was they started adopting when I was 7 years old, and I did that till I went off to college at 18. So um, it was
Amazing.
it was really good. It actually molded me and prepared me for who I am today.
Right.
I totally believe that it was something God used to form me into the man that I am today. So it was
No
good,
doubt.
very good, very good. Um, I I tried to. I graduated. I was homeschooled, and so I graduated from high school early, and they no one would take me on as a student when I was 16. So
Yeah.
so I applied to every naturopathic medical school I could get in that would take an application from me.
Right.
And finally, as soon as I turned 18, I started into naturopathic medical school.
Yeah.
Um, when I was in my third year, it was in my third year of naturopathic medical school, Washington, D.C. opened up a license.
Mm-hmm.
And if you could present with a degree or a diploma in naturopathic medicine, they would let you set for their exam. And so I worked it out with the school. They gave me an advanced standing certificate, and I went to Washington D.C. and took the exam, and I passed. I passed the first time. I was a lot of what I was studying in naturopathic medical school was old news for me because I grew up with it.
Right.
You know, everyone else, it was these new discoveries. I was like, oh yeah, I read that book when I was 11. You know, it was.
Yeah, having the best two mentors, around
Right.
living it.
Exactly.
Yeah.
Right. And we used to tease Dad that this green stuff that he would give us every couple days was we were watching. We said, we're watching you. We want to make sure that this, do we have the green drinks every day after you cut the grass? Is that what?
That's what my daughter says. She suspects that I just give her grass,
Right.
My husband drinks it as well, like, it's good. It's good.
It's good.
Well, it gives him energy, so there you go.
Exactly. It's perfect.
Awesome. But doctor, could you tell me more about your siblings, especially the one on the spectrum and with schizophrenia and so on? Because that's what I was telling my friends and other families on the spectrum when I was mentioning about you, that you grew up and you were helping, and that actually your siblings were growing up and getting better and without, psychotropic drugs or any other very intensive interventions.
Right.
It was all through naturopathy and physiotherapy and chiropractic and
right. So here's what's real interesting. As you look at all the different cases of my 32 brothers and sisters, the ones with autism or on the autism spectrum, or with cerebral palsy, or with Tourette's, or
any neurological disorder.
I had 9 brothers and sisters that had seizure disorders. I had one brother that had between 150 and 80 grand mal, 150 and 180 grand mal seizures per day.
Oh my! Wow.
Medicated. He was on 5 different medications when my parents adopted him. He was still having between 150 and 180 grand mal seizures per day. There was actually, my dad figured out an adjustment for his neck in to stop the seizures, and so we would. There were 2 or 3 of us that learned how to do that, and so as he would go into a seizure, we'd get hold of his head and get his neck and bring him right out. He'd be.
It worked.
It worked every time. Here's what was really funny: is we had a golden retriever dog that developed epilepsy as she got older, and it worked, the same adjustment worked on the dog. It was.
Yep.
So,
wonderful.
It was interesting. So what my parents did, this is what they did. They had, they used the blood type diets. I don't know if you've ever heard of that.
Yes.
The Diadamo blood type diets. They knew Dr. Diadamo and they followed his work, and so they utilized the blood type diets along with probiotics, enzymes, and then what are called nervines in botanical medicine. Okay, so things like hops flowers, or kava, or valerian root, and chamomile. And what they found is that if they could reduce the anxiety that these children had, slow everything down, everything started to work better. Okay, it became workable. Okay, my parents raised their family full time. That was what their primary thing. If you can imagine, I have 18 of my adopted brothers and sisters are bipolar. So
Fun!
yeah, so
Unpredictable.
that was I used to joke. I had more like 50 brothers and sisters. Actually, it was.
Yep. Yeah. Wow.
But
Oh, do we have a technical difficulty?
what they found.
Oh, you're back. For a moment,
Okay, good,
the
good.
picture froze. You're back.
Oh no. Okay, okay, very good, very good. So what they would do is they would have their specific diet, which was interesting if you think about it. My mother fixed 4 meals 3 times a day. So after every meal, she fixed four. She'd fix 4 separate meals. It was a
Yeah.
uh, meals
Talk
were a
about the same.
production. Exactly. It was amazing, amazing. So 4 different meals 3 times a day was what they would fix. My parents would get together. They'd start with breakfast, and then everybody would get cleaned up, and they'd do classes and things because they homeschooled all of us
Right.
also, by the way. And so we had classes in between breakfast and lunch, and then we'd have production of lunch, and then on into the same thing throughout the day. It was really really interesting. Um, and they had us almost all of us in martial arts classes at night. That was it. So they had a
I love it.
regiment. It was a very
Structure.
regimented structure. Lots of
Yeah.
structure was, and that was extremely important. Um, it was for me. It wasn't. It was here or there. I didn't mind. It didn't bother me. I didn't
Mhm.
mind if we had structure or didn't have structure. It didn't bother me. But what I noticed, almost every one of my brothers and sisters, because of their, and mostly because the anxiety and the emotional component of what they were dealing with, the
Mhm.
structure gave them security.
Yes. It's
And
very
so
important.
it is super important for them. So having that routine was
Yeah.
very important. That took the anxiety out, and that
Mhm.
was what my parents said, that if they focused on helping the children find peace,
Mhm.
they would get better. If
Yeah.
they couldn't
Makes
find
sense.
peace, they had a real hard time getting better. And
Mhm.
so that was a big portion of what they did. And that was, so from a spiritual standpoint,
Mhm.
we had our Bible studies, our prayers that we did all every day, and
Mhm.
we had times of the week where we would pray for each other. It was part of
Oh.
our upbringing. It was just what we
Yeah.
did, and uh, Dad said that the boys were always laying hands on each other, you know.
Yes. Uh-huh.
He was trying to get us to stop laying hands on each other. That was
Right.
but it was that structure. And
Yeah.
for me, here's what was really interesting. When I one of my doctorates is in monastic medicine. I went
Mhm.
back in the church and studied monastic medicine and the monastic medical practices that we've had for a couple thousand years. And what's really interesting is I actually grew up with those principles. It was something I didn't even know I was growing up with those principles, but I grew up with those principles. It was
Yeah.
wonderful, very wonderful. Um, in So when I studied it, the main professor I had said I should have been teaching the class. He's like, he's like, you know more about all this than one of it. The rest of
Right.
it. It was funny.
But that's exactly because you grew up, just like a sponge. You already absorbed everything from your parents, from
Correct.
your upbringing. So yeah, you just
It was natural. It was, for me. It was very natural. For me, the working in natural medicine is just um,
fulfilling the destiny.
it's very much a destiny for me. And so I'm here doing what I believe God designed me for. This is what I
Yeah.
was designed to do. And
And thank
so
God for you and for your sacrifice and for everything you do. And
it's wonderful.
that brings me to my next topic, because many of the autistic children suffer from gastrointestinal issues like leaky
Correct.
gut or irritable bowel syndrome. And I know that you specialize in treating those conditions as well, among many others. But could you please explain how it develops and what are the symptoms and how to treat those?
Here's, leaky gut, irritable bowel, inflammatory bowel disease, okay, of any kind, because there are whole categories, correct?
Yeah.
And there's all crazy amount of symptoms that go on with this, but what you have is okay, your gut lining is a membrane, okay? If you like the inside of your mouth, okay, it's a membrane, or inside your nose or your ears, okay, that membrane, even like the back of your eyelids, okay, it's all membrane similar to that, so it's very delicate.
Yes.
Okay, but it heals very quickly also. Okay, but have you ever bit your cheek and got a sore in your mouth?
Yes.
Okay, so think of that. Okay, that is what that is similar to what happens in the intestines when someone has had, normally you have some sort of either infection, injury, or chemical toxicity that has caused an irritation like this. You don't bite your stomach, right? You don't bite your intestine. It's not like this, but you have a similar irritation that you would have in your cheek down in your gut, and it's normally from chemicals. Okay, sometimes it's from like an antibiotic or a medication, or those types of things can do that. You Now, what we find is when children are heavily vaccinated, okay, not only the heavy metals in the vaccines, but the other adjuvants in the vaccines get what's called conjugated, or they get connected to other things in the liver. The liver expels them. Okay, when that happens, if you look at the anatomy of where the liver is situated, where the bile duct coming out of the liver goes, it goes right into the top.
Right. Oh, the picture froze. Okay, we're back.
I'm sorry. Okay, are we back? Okay, here we go. Okay, so what happens is all of those toxins that get injected into these children, okay, gets filtered by the liver, and whatever the liver can get rid of, it does. But it comes out of the liver so toxic and so caustic. Okay, it's very, very irritating to the rest of the intestines, since the liver empties right at the top of the small intestine. So it has to go all the way through all 30 feet of the small intestine, and then all 10 feet. So we got about 40 feet of tubing that all these toxins have to go through. When that happens, it irritates the whole system. Okay. Now, if you eat heavily processed foods, okay, part of what they put in heavily processed foods are antifungals and antibiotics.
Yes.
Okay, we call them preservatives, but that's what they are. They're antifungals and antibiotics. So if you eat these constantly, okay, those things go into your system, they go down, and they start disrupting your microbiome.
Right.
If the microbiome gets disrupted, now you're open to, all you have to be is exposed to a parasite or to other microorganisms and things like that, and they can come in and take up residence in your gut, which causes kind of like the infection after you bite your cheek. It gets irritated, and then the next day it gets infected, and that's when it hurts and it causes all those problems, right? Well, that's kind of what happens with with parasites and other bacterias and things like that start growing in our gut. Well, as that happens, that causes massive dysfunction in our digestive system. Okay, and so if you think of a
cloth.
A fabric. There we go. Yes. Fabric. Okay. I was going to use Spanish and say tela.
I was going to say Polish, but it's okay. Yes.
It's okay. But a fabric. Okay. If fabric. Okay. So if you have a fabric that's tightly knit, okay, it's knit nice and tight, not anything large won't just float through that. Okay, okay, you don't get big particles coming through that. Okay, but if you stretch it, okay, it pulls apart. Now you can fit bigger particles through that same fabric. Okay, well, if you think of the membranes on the gut wall as being a fabric, okay, it's a membrane. Okay, and as they get irritated and inflamed, they separate because they swell up.
Yes.
Okay, and so now as they swell because of irritation, okay, like I was trying to say earlier, is this can be caused by all kinds of different things. It's not, it's normally not one particular thing that caused it. It's usually, I use the analogy of chronic illness. Okay, chronic illness is a pond. Okay, but it has 4 or 5 different little streams or tributaries that are feeding the pond. Okay, and in order to get rid of chronic illness, you have to dry up the pond. Well, how do you dry up the pond if you have all these tributaries?
Right.
You have to go back and stop those. You got to take care of those things before you can dry up the pond. Okay.
Yes.
And so same with leaky gut. You have multiple tributaries causing this. So okay, there's usually multiple things happening. And that's why the natural approach, the naturopathic approach is so effective, in that we're not just trying to reduce inflammation. Okay, there's this whole process that I talk about, this healing process that I talk about, where if you cut your finger with a dirty rusty nail, you have to stop the bleeding, number one. But once the bleeding stops, you can't stop there. Okay, just because it's stable doesn't mean it's healed. Okay,
right.
Just like a broken leg, just because you set a broken leg doesn't mean it's healed. Doesn't mean you can go run a race on it. Right?
Yeah.
And so you have to move past that. And the way to move past that is to start cleansing. You have to clean that wound out. No dirty wound ever heals, period, ever. And so detoxification. So in your gut, what that looks like is we have to get waste out of the gut. We have to get parasites out of the gut. We have to get candida and those types of things out of the gut. And
that's a very important step. People forget about detoxifying and the importance of detox.
Correct. Because it's just like if you had dirt and rust in a cut, that wound won't heal. And matter of fact, it's going to get a lot worse.
Right.
And so if you don't do the detoxification step in the healing process, it's not going to get better.
Right.
And that has to be, just like cleaning out your finger, has to be thorough. Because if you leave one piece of rust in that wound, it's going to fester and it's going to get infected and it's going to get inflamed and all these bad things will happen. The same thing with our gut or our nervous system or anything. Okay. And so once we've detoxified the gut, things start just like a wound. Okay. Once you clean it out, it's ready to be soothed. Okay. It's ready. You can start to soothe.
Right. The wound.
That wound. Okay? And so once we detoxify, we have to move on to rebuilding and fortifying. And I from a Christian background, here's the analogy I use. If when you come to Christ, he changes your spiritual state. He stabilizes your spiritual state. He does this by taking you from guilty to not guilty. He changes your legal position, so you're not guilty anymore. Okay. Number one. Number two, I tell everybody that he then issues you a fire insurance policy, so you don't have to go to that really bad place anymore.
Thank you, Jesus. Yes. Amen.
The second, the Holy Spirit moves in and starts to cause all old things to pass away. Well, what is that? He's detoxifying you, okay? Holy Spirit moves in and starts to detoxify you. As that happens, and you then walk with Christ and you commune with God, he fortifies you into a new creation. Okay. Wow. And that's from a Christian standpoint, that's the process of salvation. Okay. In an emergency room, if you cut your finger with a dirty, rusty nail, you have to
That's a salvation as
stabilize it.
well.
It's salvation as well. Exactly.
Saving life.
Right, right. And this is the process that God designed.
Mhm.
Our bodies they work with this process. This is the process our body goes through to fix itself. And so if we
I love this
support,
analogy. I love
and
it.
that's just it. We just have to support that process. We have to work with it and step by step go through the process. And
Absolutely.
the body's designed to fix itself. And so it doesn't matter what our disease or our diagnosis really is.
Right.
Okay, because again, I tell people I don't treat disease. I treat my wife. I treat her to
Yes.
dinner, to movie, to you know.
Exactly. We don't want to do
Okay.
that to the disease. No.
No, no, I don't want to do that. Exactly, exactly. So
Wow. Yeah, I love that. And also you mentioned already about the heavy metals and how they irritate the gut and everything,
right,
but many people ask me, how did you go with Michael, my son? How did you go through the process of removing heavy metals? Because everyone is terrified,
right,
chelation, the classic chelation, in the hospital, it can damage your
right.
kidneys, calcification, and all kinds of, scary stuff. So, how do you approach
Uh,
heavy metals and mercury, aluminum, and lead? You name
all
it,
of them.
all
Sure,
of them.
sure.
Yeah.
There's a couple things, and there heavy metals are interesting uh, toxins to deal with. Okay,
Mhm.
because they like each other.
Right.
Okay, so you get mercury over here and lead over here. Well, they find each other and bond and make this whole nother compound,
Yeah.
which makes it harder to remove. It's like, oh. And then you have things like the halogens. Like you'll hear me talk a lot about the halogens. Your fluorine, chlorine, bromine, iodine. Okay, fluorine and chlorine and bromine. Fluorine more than any of the other ones, by the way. But all of these will bond to other metals and they'll connect metals.
Mm.
And so they make alloys within your system. Okay, and those are very difficult for conventional chelation techniques to remove. Okay, and just to give you an idea, I'll just do a real quick chemistry lesson here. Okay, so you have on one side you have conventional chelating methods. Those are using what are called ionic bonds. Okay, so you have a sulfur compound bonding to another compound and then carrying that out of the system.
Yes.
Okay, what I use fulvic and humic compounds, and we
Mm.
create carbon or what are called covalent bonds.
Mhm.
Okay, and the difference is, okay, if I had a big old Harley, okay, Harley motorcycle, and I was going to take my little
Right.
girl, right, I'm going to take my little girl on a ride around the around the block here. Um, I wouldn't ever even think about tying her tricycle to the back of my Harley.
Mhm.
I would never ever do that. That's not safe. I would
Of
never
course
do
not.
that. Okay, she's precious, and so I'd want to carry her in a very very safe manner around the block, so it'd be a very pleasant experience, right? And so what I would do is I would put her in a sidecar, okay, where she's protected and she's not going to fall out. She's not going to get fall down, not going to get hurt, right?
Right.
Okay, so what you have with a sulfur bond would be like tying a tricycle to the back of the motorcycle.
Wow. Yes.
Okay,
Makes
and what
sense.
you have in the sidecar, that's a covalent or a carbon bond. Okay, because
Mhm.
it's encased. We actually we encase it. It's not going anywhere.
Right.
Okay, and so that's what we do with our fulvic compounds is we take and add different carbon complexes
Mhm.
to the fulvic and the humic compounds uh, to make them more powerful chelators. So they already have this delivery mechanism that they do where they communicate with cells and will give the cells whatever it wants and will take whatever the cell doesn't want away from it.
Yeah.
Okay, it does that, but when we take and add these different carbon complexes, they do these covalent bonding
Right.
uh, procedures, okay, to the toxins that cells are trying to get rid of.
Mm-hmm.
And so we get very quick and very efficient heavy metal detoxing. And what's nice is this fulvic actually is very good at destroying fluorine or halogen bonds. Okay, so it'll like pull the glue out of those alloys that get made when fluorine connects with mercury or with cadmium, or and then they all kind of stick together. Those things cause calcifications.
Yes.
Okay, they cause calcifications in the brain, in the
Mm-hmm.
nervous system, in the joints, okay, in the heart, all those types of things. Because they're so toxic, the body's trying to protect itself.
Mm-hmm.
And so it walls them off with calcium.
Yes.
Okay.
And that's why people are terrified to go through the conventional chelation, and it's pretty risky.
It is risky. It is because you're, again, I wouldn't want to move those things like a
Right. I think we have technical difficulty again. Doctor, can you hear me? Oh, I hope we can get Doctor back. It's a very important topic. Oh, please, technical difficulty. 1 second. Bear with us. Yes, we have you back. Wonderful.
Okay, very good, very good. There we are. Okay.
Chelation.
So,
Yes.
chelation. Okay, so back to chelation. So you have like EDTA. Here's another interesting fact. EDTA has 8 receptor sites for it to pull minerals and metals. Okay. You have to bond it to either sodium or calcium before you can put it in the body. So you lose 2 of those receptor sites. So when it goes in, EDTA only has 6 open seats in that car. Okay. And so you can only fit 6 more passengers in that molecule. All right. We have fulvic has 60 open receptor sites. Okay. When we treat it with the different carbons that we bond to it, we open that up. We have one chelator, one compound that we work with that has 420 open seats.
What a difference. Yeah.
Right. And so it's massively more effective and efficient. And because we're creating covalent bonds, we're not dropping our, we don't lose anywhere near the amount of things. And when you start moving heavy metals around, you think of this. Okay. Think of having a sliver in your hand. Okay. Okay. So you have this sliver in your hand. Think of the process that happens when that, so it gets irritated, it swells up, it gets infected. Okay. All those things hurts. It's very painful. Okay. So, heavy metals are like a sliver in your foot, just in every cell of your body. Okay, so it's already causing massive oxidative stress.
Yes.
Okay, and that's what feeds into this whole inflammatory process that people are dealing with when they have heavy metal poisoning. And so children with autism or that have been have had nerve damage because of heavy metals, those what's happening is their nervous system has slivers in it, if you will. Okay, and so they're responding accordingly. Their symptoms are appropriate. They're hurting. They're not. They don't feel well. They have a lot of pain, and that's why they don't like to be touched. That's why they don't. The contact, and they, if you can imagine having a massive headache, you don't want to look at somebody in the eye. I mean,
right.
Okay.
It all makes sense. Yes.
It all makes perfect sense. So since there is already that massive oxidative stress going on, if you go in and start moving metals, you increase that stress. Just like it hurts to pull a sliver out of the bottom of your foot or out of your hand,
Yeah.
okay, it doesn't feel good to pull that sliver out, okay? That hurts. It's important, but it doesn't feel good.
Mhm.
Okay, so what we have, if you look at fulvic, has 22 tetratrillion electrons.
Okay, that's beyond my brain.
Okay, now vitamin C has 6 electrons to donate.
Wow. Mm.
Okay, and vitamin C is a powerful antioxidant. Okay, it reduces oxidative stress. Think of the amount of vitamin C you'd have to take to get the same benefit from fulvic.
Yeah.
You see what I'm saying? That's why I'm always so excited about it.
Yes.
Is it has this, not only does it chelate, but it has this antioxidant capacity that's beyond anything else we've ever discovered. Okay, and because of that, when it pulls the sliver out, it also soothes that wound.
Right. Mm-hmm. And also the fulvic acid is very concentrated, right? It's like,
Correct. Very
yes.
concentrated, very, very concentrated, right. So it only takes a little bit to get a big job done.
Mm-hmm.
And um, and this is because of this antioxidant effect that we have. Um, we Most of the time people start taking our product and their heavy metals start reducing and they don't even know it.
Yes. I mean, I'm taking your black brew and
Very,
just
very good.
showing to our audience. It's an amazing product. And could you please tell us more what's in it and why the products used there, the ingredients are fermented, and how the whole process is
Correct.
formulated?
What? Okay, to give you a little history on this, initially we developed that product for uh, a heroin detox clinic.
Right.
Okay, and what it was okay, what, because the people needed to detox fast
Mhm.
and painlessly. They need, because their
Yes.
body is in such massive stress
Hmm.
from the heroin and the addiction, that they almost die in the first 72 hours coming off of it. It's so
Yeah.
terrible for them, you know. And so we worked with that till we got it to where they could they were about 80 to 90% symptom free in the first 12 hours. Okay,
Yeah.
and so we started using that, and I started using it clinically. It detoxed so much better than we didn't we didn't expect it to be that good. It
Yeah.
was,
I know.
you know, it was one of the, we knew it was going to be good, but we didn't expect it to be that good. And
Right.
so we started using it clinically, and my gosh, we would do hair analysis and
Mhm.
check people's metal levels, and we would do urine collection
Right.
after, doing, either giving them DMSA or EDTA IVs and things like that.
Mhm.
And we found that we would have most people clear of heavy metals within the first 90 days. We have 80 to 90% of their heavy metals would be gone within the first 90 days of taking this product.
Yeah.
Um, and it actually, at one point, I had even quit doing most testing. Uh, we would just put people on it for a year, and then we'd have a test at the beginning of the year, test at the end of the year, and it was clear.
Comparing. Right. Wow.
um, and they
Yeah,
had
I mean, I can
almost,
testify. I feel great taking a black brew, and I give it to my whole family, especially to Michael, and he has improved dramatically. I mean, yes, we tried different therapies over the years and over the last few months, like even neuroacupuncture, which we saw great results in New Mexico. But also, he was not prepared for that because he didn't go through the detox process. So when we came back, we were advised to go through the proper detox protocol and everything, and we did. And that's why I added your formula, black brew, and the fulvic acid equalizer concentrate.
Good. Good.
Amazing.
Perfect.
Amazing.
We've
But
had
with detox and the whole process, our children, especially nonverbal, who cannot communicate where they hurt, they often get anxiety because they don't understand what's happening with their body. They suffer from insomnia and depression and all kinds of other side effects. Could you please advise how you would deal with that? And
here's what I've found. This is just clinically. This has been a protocol that I've done clinically. Um, we would take the amino acid L-tryptophan.
yes,
We would use L-tryptophan and another amino acid called L-theanine. Okay, those two amino acids, the L-tryptophan, we'd find if we gave that to the children at night. We normally would have to give anywhere on the very, very low end 500
500 milligrams. Doctor will be back. Bear with us. It's a very important piece of information. We're talking about L-tryptophan. Doctor will be back in a second. Just stay with us. I believe it's the internet connection. But we're talking about L-tryptophan and L-theanine. We'll be right back. We're trying to fix the problem. Bear with us, and we'll ask this question. Adriana will definitely ask this question to the doc. Bear with us. When the doc is back, we're going to continue talking about the detoxification and about side effects and different conditions like anxiety, depression, aggressive behaviors, and which products he recommends for those conditions and how do they work. So please stay tuned. Stay tuned. Bear with us. Okay. I believe doctor has a connection problem. We'll be right back, but to sum up what we already heard, you heard about the importance of the steps in the process of getting rid of heavy metals and how to heal the leaky gut and how it comes on. And so please, we have doctor back with us.
Okay, good.
Professional.
Oh my goodness.
We stop at L-tryptophan, and
L-tryptophan.
we
Okay.
have a question. If you can read the question on the screen from Adriana.
Okay.
Basically,
Yes, it would be very possible. Yes. And initially, what I would do with patients initially when we first started using this is they would just get the capsules and open the capsules and put them in juice or water or whatever. And with a feeding tube, it's no different. It would be just feed with you could mix it in probably best with water, mixed in with water and given that way. With amino acids, they absorb better if they're given by themselves with nothing else. A lot of times I use the black brew. We'll mix that and it'll help solubilize the amino acids in water or juice, and it also helps to deliver them. So we would start off with 500 milligrams of L-tryptophan at night. In some cases, we had to go all the way up to 6,000 milligrams of L-tryptophan at night. It was a lot. And for those with typically more aggressive behaviors, we'd also do the same in the morning.
Mm-hmm.
So whatever they took at night, they would also take that same amount in the morning. And we start with the L-tryptophan and see how they respond. If they respond really well, that's all we would do. We wouldn't add anything else.
Mm-hmm.
If anxiety was a particularly a big issue for them, if the L-tryptophan didn't correct the anxiety, what we would do is we'd add the L-theanine.
Mm-hmm.
And that we would start at 100 milligrams and go all the way up. I've only had one case that needed 1,000 milligrams twice a day.
Mm-hmm.
But that was our. We started 100 milligrams. We would add that at night, and then if they needed it again during the day, we'd do the same thing. And the nice thing about those things is they're not habit forming.
Mm-hmm.
What they are is nutrients, okay, and your body makes neurotransmitters out of those nutrients.
Mm-hmm.
So serotonin and dopamine and those types of things get made from these amino acids by our body. And so what we're doing is giving the body more raw material to
Right.
start making these things. And so it really helped while taking the children through their detox programs, in their diet modifications and trying to reduce their inflammation. While doing that, giving them these things would normalize quite a bit. They would
Right.
help normalize a lot of their behaviors.
And doctor, you and your wife Gina, by the way, amazing lady, and I
She's
hope I will
wonderful.
have her on my show sometime soon. You wrote the book Detox for Life, and this book has helped us tremendously. I mean, we
Good.
follow recipes. I love our chia pudding with all
Oh,
kinds of berries. I love it. And but it's not about just the recipes. You describe the detox process depending on the level of you know um, how someone is advanced in their detox protocol, or if they ever had any detox in their life. So depending on their level of experience with
right.
detox, you lead them step by step and you explain what to eat. And you always say, start with replacing whatever you eat now just with organic. And this is
Correct.
such an important step. And can you explain why organic? Because many people say, yeah, I do juicing and so on. I buy, from Walmart or whatever produce,
Right.
which is cheap, but it's GMO or sprayed with
Right.
pesticide. Why this is bad?
Here's the thing. Yes, organic food has more nutrition.
Mm-hmm.
Just that's a given. Okay, it does have more nutrition. There's more nutrients. There's more. Um, even like fresh food, you're going to have more active enzymes in
Mm-hmm.
organic food because it hasn't been damaged by pesticides or herbicides.
Right.
Okay. The other thing that is, in my opinion, even more important is that organic food is going to be is certified to be 95% less toxic. Okay.
That's a
So
huge
that's a huge thing. And so you have there's 95% more pesticides and herbicides and chemicals that are allowed on non-organic food that you can't they can't have the certification as organic if they're having these things in their produce. Okay, so you're only exposed to about 5% of the toxins that you would normally be exposed to if you eat organic food.
Mm-hmm.
That's number one. Number two, there's organic food has more nutrients to it. Okay,
Of course.
and then number three, the nutrients that are in the organic food is of higher quality.
Mm-hmm.
So it actually works better.
Mm-hmm.
Your body will recognize it. And then last, organic food cannot be GMO. Okay,
Right.
and GMOs is something very. If you don't walk away with anything else, remember that GMOs are anti-nutrients. Okay, this is something that has been very well documented at this point.
Yeah.
That the GMOs not only don't have all the nutrients even just the normal version of the same food, okay, the
Mm-hmm.
same fruit or vegetable, they don't have the same amount of nutrients that other fruits or vegetables would have. Number one. Number two, the genetics of a GMO product mix with our genetics and turn off our capacity to absorb different nutrients. And so they become an anti-nutrient. And so if you're eating organic, organic by definition cannot be GMO.
Right, of course.
And
I
so,
mean,
yeah, those
that's
are
why it's so important to feed your family, organic
right.
and non-GMO, because like you said, it's mutated and it's mutating with our cells
Right.
and everything, which is very bad.
Right.
So
The uh, we have found we don't eat as much if we eat organic. That was one of our
that's true.
organic food is
You
far
feel
more
more
satisfying.
satisfied with all the nutrients inside the good organic food. Even
Right.
eating one apple, you can feel satisfied for an hour or two.
Right. Right.
Where when you get the pesticide sprayed, all shiny, beautiful red or green apple, you're
It's
eating
not the
the
same.
wax and everything. Oh, yes,
Right.
it's true.
Right.
And doctor, you said you were gonna give away one program, 2 weeks
Yes.
detox program. Could you please
Yes.
tell us more about that? Because
Yes.
our viewers would love your product. And Adriana is also asking, where can I get this product?
Oh, very good. Very good. The let's see here, Black Brew and Equalizer and our 2-week detox program. They're all, you can find all of them at drnuzum.com. That's drnuzum.com. We have a code. Let me see here. Oh, I think it is Children's Health. I think is the code. Let me check 1 minute here.
It's drnuzum.com, right?
Yes, ma'am. Yes. There we go. 1 minute. We'll have a code for you here in just a minute. I wrote it down, but I left the paper in the other room. So.
Okay. We will have the code, the discount code for our viewers, definitely. And one lucky winner will get this program for free. So if you comment, if you like our video, share with the world, because it's very valuable information. It's not just about autism, as you heard. It's about leaky gut. It's about your general health. It's how to get better and feel better through detoxification, how to do the process correctly.
Correct. There's a lot of people, even in the natural medicine world, a lot of other doctors that they put people on, laxatives and things like that, and call those things a detox, which they are to an extent.
Yes.
Okay,
Yes.
they definitely, if you have somebody that, for example, a laxative, if your bowels aren't moving, all of that waste that's not leaving your body is recirculating into your system. So it's important that that is moving. Okay, so of course but if the microbiome isn't reset and the microbiome isn't healed, you'll end up on the laxative for forever. Okay, that's not healed.
Right.
Okay, the problem's still there. Okay?
And the body can get used to the extra support and get lazy, right?
Exactly. And so that's kind of like putting a sprained ankle in a cast and just leaving it there.
Yeah.
And
right.
Your foot never gets better. It just doesn't, doesn't get hurt anymore. And so, so detoxing is another. It's a process. Okay, so there has to be drainage of the system. Okay, we have to drain bulk in large accumulated waste has to leave the system. It's kind of like
drain the pond.
Drain the pond, exactly. I use the analogy, if we had a party, let's say we came to your house, we had a big party, and we stayed up all night, and finally way early in the morning we're all passed out, and but we get up later and we want to fix eggs, and we go into your kitchen and there's
Ah,
pots and pans and food and drinks and plates and everything
yes,
all over the place. Okay, we have to go through different stages of detoxification of the kitchen in
yes,
order to make it functional again. Okay,
right.
so first we have to accumulate all the waste, all the dirty plates, all of the dirty dishes and those types of things, and clean them out, get all the bulk waste out, take the garbage out. Then we come back and we have to clean the counters, we got to clean the stove, we got to
Mhm.
clean the dishes, get all the little stuff, okay, the leftover waste eliminated. Then we have a functional kitchen. We can
Right.
make whatever we want.
Mm. I
Okay,
love your analogies. It's
but
just so, if someone is visual like me, if you tell me something in pictures, I can see it and it's so simple.
perfect. So what we have is uh, the initial stages of detox has to be like removing the big waste out of the
Hmm.
kitchen, getting the if we use paper cups and paper plates, is getting all those paper cups and paper plates and then putting in the garbage can, cleaning,
Getting
taking
them
the
off.
garbage out,
Mhm.
then we have to go on to cellular level or cellular detox. Okay, and that's when you clean the plates, you get the forks and the spoons clean, you get the countertops clean and
Yes.
everything. Okay, and so there's that two phase, and so our 2 week detox is designed to get you through that drainage stage. So
Mhm.
we get the bulk of the waste out of your system. It also works on the cellular level, but it's predominantly designed to get the bulk of the waste out of your system. And I have had I had I had a patient that went on 3 2 week detox programs in a row. Okay,
Oh,
in
wow.
6 weeks, this patient lost 50 pounds in 6 weeks.
I'm on the wrong detox.
Can you can you imagine though? And it was just removing waste from the system, and so
Even on this detox, doctor, I am right now
correct,
I'm finishing the colon and lymphatic system detox,
perfect, perfect.
and I visit the restroom, the ladies' room, definitely more often than before. So I know that my body is getting rid of a lot of
Eliminating.
stuff. And I thought that I was healthy. I was doing my juice detox and water detox and everything. But whew, years and
It's
years of
it's
antibiotics
amazing.
and medication, it's all coming out now.
Good, good, good. And that's what it's what all of these things are designed to do
Hmm.
is initially it's kind of we go back to the wound, okay?
Hmm.
Um, we got to get the bulk of the toxins that are in that wound out of the wound.
Right.
And once we remove that interference, once we remove that roadblock, the body can progress and fix itself. And so that's what detox programs are all about. I got the code here. Here we go. Okay, it's healthy child, all one word with a capital H. Healthy child, all one word,
Okay.
capital H there. I will send this to you so you have that for sure.
Mhm.
Okay, very good. All right. Well, do you have any specific questions? Anything?
Well, that was the main question that a lot of parents were sending me, like, how do you detoxify, and is it safe with children? What about the black brew? What can you expect on this detox program? Will my child be more irritable? Will he be more aggressive, anxious, insomnia? You name it.
Sure, sure. Sometimes okay, and here's something to remember in the process. Okay, remember that you have to drain the bulk of the toxins out of the body first. Okay, if
Hmm.
you go too heavy on cellular detox,
Yes.
okay, the cells will release their toxins but they have no place for the toxins to go.
Right.
Okay, and that actually is something that what in my experience, I've been in licensed naturopathic practice for 22 years. Okay,
Yes.
I've been I'm a naturopath, an osteopath, and now I'm also a doctor of Oriental medicine.
Mm-hmm.
In the last 22 years, what I've observed in detox clinics and situations is that they're either draining people properly,
Mm-hmm.
or they're causing cellular detox to happen properly. The problem is they're not doing them in steps. And
Right.
so what we have is we'll have people draining the system, getting all the waste out of the way, and they get good results.
Mm-hmm.
But they don't last because they didn't go the next step and get the cellular detox
Yes.
done. Okay.
Yeah. Which is
And then we
cleaning the
have
surface after we throw away the cups and plates.
exactly. And so on the other side, we got people that are excellent at cellular detox, but once the cells take all those toxins, they throw their trash bags out,
Uh-huh.
and they're staying in the street. No one's
Right.
coming by and picking them up, draining the
Yeah.
waste away.
Right.
Okay. And
Yes.
so there's more problems happen then because of that. And so if we don't do this in a two-step manner here,
Mm-hmm.
we it's not as the benefits aren't as long lasting. I
Right.
guess is
I mean, as a mom of freshly diagnosed boy, 3-year-old, it was back then in 2010, and I was already pregnant with our daughter, and I was just terrified because I went to pediatricians and they just they said, oh, he looks he's fine, he's in bilingual home, so delay in speech, yes, it's fine. I was like, yeah, but he was talking before, and I know that he understood 2 languages fine, and even the third Greek language. But then, it changed and he started having those gastrointestinal issues. So no doctor would help me. So I had to find Dr. Google, sadly. And, you get good and bad information, but I had to just put everything together myself and do more research. And over the years, I reached out to a lot of parents who tried different therapies, who had DAN doctors, Defeat Autism Now. I think now they're just naturopaths, and you no longer call them DAN, but unless it's your case, which is your name, but it's. But
Right.
I had to search, and I didn't know. So when they were telling me, you try gluten-free, dairy-free diet, so I did. I immediately jumped, and cut off any dairy. And Michael slept through the night for a very first time after a long time, just cutting off dairy, and he would sleep through the night. And then his bowels started improving. After
Right.
3 months, I cut off gluten and replaced everything with gluten free, even though we didn't have proper tests. So I begged our pediatrician to prescribe laboratory tests to show if he's sensitive or allergic to gluten and casein and all kinds of food allergens. And of
Right.
course I was right. My gut feeling was right, which I think gut is our second brain, or maybe even the third brain.
Correct. The your gastrointestinal tract has twice as many nerve endings as your brain.
How about that?
There's
Yeah.
twice as much nervous system in your gut as there is between your ears. um, so
Makes sense.
here, it does. There's your what's different. Here's something real different. What you have here in your head, okay, opens to the outside world through your eyes, your
Mm-hmm.
ears, your nose, your mouth. Okay, you have all this, but it's encased behind bone.
Mm-hmm.
Okay, your brain is inside your head. Okay, we go down.
Oh, I don't want to miss this part. Ah, come back, doctor. We need you. We talked about the brain. Oh, guys, we lost doctor, but he's coming back to tell us about the difference between the brain in the head and the gut brain. So be with us. And please go to his website, drnuzum.com, and use the code HEALTHYCHILD, what you see on the screen right now, and you will get a discount. But also, we will have one lucky winner today. If you like and comment our video today, we'll have 1 2-week detox protocol for you. And also, just if you have any further question, please comment below. We'll have 24 hours before we choose the lucky winner. And if you have any questions, I will pass them on to our doctor, and he will answer in his time. So I hope you enjoyed the show. And we're already past our time. I will try to have doctor again, especially if you have more questions or if you want to try the detox and share your story. If you have more questions regarding autism or autism related conditions, please write down your questions below. Thank you so much for watching, and God bless you guys. It was a great show. Thank you, doctor. God bless.